Yes.
Hello, my name is student nurse Lorraine. I'm here to do a head and neck assessment on you. I'm just going to wash my hands and provide for your privacy. Put on my gloves. And may I get your first and last name, please?
Mary Kirsch.
Thank you. And also your date of birth?
1/17/1960.
Perfect. And do you know where we are right now?
PVH.
Excellent. And what time is it?
9 p.m.
Awesome. And why are we here today?
Head and neck assessment.
Great. And how is your mood today?
Oh, good.
Excellent. I'm glad to hear that. All right. I'm just going to quickly take a look at your skin. I note that it's very smooth and peach. I don't note any kind of redness going on. Just going to touch. You feel warm to me, which is a very good sign. I'm going to take a look at your nails here and just gently squeeze the tips to assess your capillary refill. And it's all very brisk, which is perfect. That's great. And normally I would do all of this bilaterally, but for the purposes of this demonstration, we just do unilaterally assessing things. And then also I would get a full set of vital signs before beginning. All right. I'm gonna take a look at your skin here and just give it a gentle pinch. What I'm doing is I'm looking at your hydration status and assessing the turgor, and I see no positive tinning, so that's good. It looks as though you're hydrated to me. Okay. Your hair looks soft and pliable, and I don't note any alopecia. It looks evenly distributed. I'm going to feel your sinuses, okay? So if you could just set your glasses aside and let me know if you feel any tenderness when I do this, okay?
Okay.
Your maxillary sinuses.
No.
Okay. And your frontal sinuses.
No.
Excellent. Now at this point, I'm going to feel 3 different parts of your face. And then once I do that, just let me know what part of your face you feel me touching, okay?
Okay.
So please close your eyes.
Forehead. Cheek. Chin.
Perfect. Thank you. And go ahead and open your mouth against my resistance. Perfect. And smile for me. And puff out your cheeks. And close your eyes. And open. Great. Your cranial nerve number 5, trigeminal, and cranial nerve number 7, facial, are intact. Now I'm going to just take a look at your trachea and your thyroid and gently feel it. Does that feel tender at all?
No.
Perfect. And they are midline. So that's just what we're looking for. Now go ahead and push your hand against, or push your head against my hand. Perfect. And now this way. And nod up and down for me. Now shrug your shoulders against my resistance and place them back down. Excellent. Your cranial nerve number 11 is intact. Now I'm just going to take a listen to your carotids really quickly. So all you have to do is relax while I take a listen. Sounds good. I don't note any turbulent blood flow or bruits. Excellent. Thank you. Now at this point, I'm going to palpate your lymph nodes gently and just look for anything that's enlarged about the size of the pea or more. Please let me know if anything's painful or tender at all to you. So here's your pre-auricular lymph nodes, post-auricular lymph nodes, tonsillar lymph nodes, submandibular lymph nodes, submental lymph nodes, thank you, and your anterior cervical lymph nodes, posterior cervical lymph nodes, occipital, feel good, supraclavicular, feel great, and so do your infraclavicular lymph nodes. Excellent, thank you. Now I'm going to whisper a word. Let me know what that word is once I do it, okay?
Okay.
Blackberry.
Blackberry.
Perfect. Now I'm going to help you to your feet. We're going to do what's called the Romberg test. So go ahead and stabilize yourself and close your eyes and just try to hold this position for about 20 seconds. Okay, 20 seconds has elapsed. You can sit down. You did a great job.
Thank you.
Your cranial nerve number 8 is intact. Now I'm going to take a look at your ears externally, and then I'm going to look into them with my otoscope, okay?
Okay.
Now, before I get started, I'm palpating your mastoid processes. Do you feel any tenderness?
No.
I also noted beforehand that there was no drainage or any redness there. Does this feel tender at all when I feel here?
No.
Okay, great. Now I'm going to just take a look inside. I'm going to pull back on your ear just a little bit. I see the pars flaccida of your tympanic membrane is intact. I see that the umbo is intact too. I saw that the pars tensa was intact and also the cone of light. So that's great. Thank you. Now at this point, I'm going to assess your eyes, okay? So first, take a look at my chart and let me know the first 3 lines that you see.
958742843.
Okay, perfect. Thank you. And I'm just going to shut off the lights for a moment and shine a light into your eyes to assess your pupils, okay?
Okay.
So go ahead and cover one eye. Okay, perfect. Excellent. Now we're going to do both at the same time. Okay, great. Your pupils are equal, round, and reactive to light, and they accommodate. Now I'm going to also have you follow my pen light, okay, with your eyes without moving your head. All right, great job. Your cranial number 2, optic, your cranial nerve number 3, ocular motor, and your cranial nerve number 4, trochlear, and your cranial nerve number 6, abducens are all intact from what I see here. So thank you. And now we're going to move on to your nose. So I've got one thing for you to smell. If you could just occlude one side of your nose and let me know what it is you smell.
Cinnamon.
Excellent. Cranial nerve number 1 is intact. Now I'm looking at your nose. I see that it's symmetrical. I'm just going to take a quick peek inside to see what your nasal mucosa is looking like. And I see that the inferior and middle turbinate are both pink and moist bilaterally, and I don't see any sign of a deviated septum, which is perfect. Now, I'm going to take a look inside your mouth, okay? So go ahead and open up and say ah for me. Perfect. Your uvula is midline, and your soft palate and uvula move at the same time when you say ah, so cranial nerve number 9 and 10 are intact. I see that your buccal mucosa is pink and moist. I don't see any signs of dental caries. I also note that the tonsils are absent. Did you have those removed?
Yes, I did.
Okay, great. So that would explain that. Go ahead and stick out your tongue at me, please. Perfect. Your cranial nerve number 12 is intact. Is there anything I can help you with before I go?
No, thank you.
Okay, thank you so much for helping out today. I'm just going to wash my hands. Here's your call light. If you need anything, please let me know.
Thank you.
Have a great day. Thanks so much.
You too.
Provide privacy. Thank you.